Mental Health Hour. And tonight, to She Speaks, where women's voices, stories, and expertise takes center stage. I'm your host, Felicia Fishoff, registered psychotherapist and founder of Rooted in Resilience Psychotherapy and Wellness. And I'm thrilled to be here with you for our very first episode of 2026. Come on. So, we are stepping into this new year with intention, honoring truth, well being, and the capacity for healing in our communities. Tonight's theme is one that is deeply personal, deeply misunderstood, and deeply needed. Fed, not failing, when breastfeeding feels heavy. And we have the perfect guide to lead us in this conversation tonight. I am honored to be joined by Niama Duri, a pediatric registered nurse, international board certified lactation consultant, and a clinician who brings heart, evidence, and lived wisdom to her work. Niema also holds a Canadian perinatal mental health certification, and she is the founder of Postpartum Travel Nurses, a home care nursing agency supporting families during the perinatal period. Having witnessed firsthand the physical, emotional, and psychological changes that mothers experience after childbirth, Niema is deeply passionate about offering judgment free support and practical care, not just for feeding, but for mental health, bonding, and recovery. She created postpartum travel nurses to provide exceptional, preventative, and compassionate nursing care that meets families where they are, in their home, in their vulnerability, and in their new season of life. Tonight, we are opening the conversation wider, beyond breastfeeding as a goal and into mental health, shame, stigma, identity, and choice. Our hope is simple: to empower parents to make informed feeding decisions that honor both baby and the person feeding them physically, emotionally, and spiritually. But first, a gentle reminder: the conversations shared tonight are for educational and informational purposes only and should not be considered medical or mental health advice. If you have questions about about your specific feeding journey, mental health, or medical needs, please speak with your healthcare provider, lactation consultant, or therapist. If you're tuning in live, stay with us. Drop some questions in the chat and join in on the conversation. If you're catching the replay, be sure to like, comment, and share this episode with someone who could use the reminder that fed is best and mothers deserve support, not pressure. All right, so let's get into it. Niama, welcome, welcome, welcome.
Hi.
Hi, girl. How you doing?
Good, good. How are you?
I am doing well. Thank you so much for joining us on our show today.
Of course, of course. This is a very important topic to talk about. So I'm really happy to be here.
Absolutely. Absolutely. And, I know that this is your baby. Like when we talk about breastfeeding, this is your creme a la creme. So I'm so excited to dig in tonight. I typically start off our conversations by asking, why does the Love Bay family need to be talking about this topic?
You know, a lot of the conversations I have with my patients in the hospital or private clients with my business is I wish I'd known. I
Mm,
wish someone took the time to give me all that information so that I could make that informed decision.
yes.
Right? A lot of
Yeah.
decisions that are made in times of despair or times of vulnerability.
Mm,
And we need to take the time or find the way to take the time to give that space to have those difficult conversations as well as giving them power to
yeah.
make those decisions. And that's why I think these conversations should happen here,
Mm-hmm.
happen at the bedside, should happen
Yes.
at home,
Yes.
be everywhere at any time.
Yeah.
Should happen with your children,
Mm,
right?
yes.
One thing that I talk about often is, in the society we're in now, we don't really see it the way that our ancestors may have seen it, or our grandparents or great
Mm, yes.
the village, the openness and breastfeeding or being together and supporting each other.
Mm,
And it's because we don't see it the way that they have, it's not
Yeah.
really normalized,
Yes.
you know.
Yes.
And
Mhm.
I've spoken to a lot of younger, like youth and young moms, and uh, one a young adult said to me, "I thought that was that's like so archaic."
Mm.
And so
Yeah.
there's so many different perspectives, and I think,
Yes.
yes, we have the CDC says this, and World Health Organization says that, but it's just there, and it's not
Mhm.
fed to the public in a holistic way.
Yes.
There,
Yes.
yeah,
Yes.
that's why.
Absolutely.
That was long-winded, but that's
No, not at all. Not at all, girl. You're already trying to drop all of the gems. All right. So, when you think about like even just like breastfeeding in general, because I know that you were kind of alluding to this, what are some of the stigmas that are out there when it comes to breastfeeding, and what are the pressures that you've seen moms face?
there's different ways of looking at it. Okay, so some moms feel, so let's take the word, what we used to say was breast is best,
Mm-hmm.
for
Hmm.
example,
I remember hearing that.
right? And so whenever there's difficulty with breastfeeding, when
Hmm.
moms have that difficulty with breastfeeding, and then they have this coined term of breast is best, so then I'm not giving the best, I'm giving second best, then that feeling of failure is there,
Yeah.
shame, guilt, and then that equates to lots of stress, postpartum anxiety, depression.
Yes.
So we kind of spiral into these things because of the choice of words that are being delivered, right?
Yes.
And even in the word fed is best, yes, fed is best, but we're also taking away from the benefits of
Yes.
breastfeeding that both mom and child can get. So
Hmm.
we really need to look at how wording really impacts moms, families in that time of vulnerability,
Absolutely.
how we deliver the message, and how it's not one or the other, but if we are approaching it in a way that is holistic, supportive, and we're looking at the whole body, not just the anatomy
Yeah.
here, right?
Yeah.
Not just the science, but also the family dynamics, family systems, then we may have outcomes in better breastfeeding outcomes. We may have
Absolutely.
all of that, but we're
Yeah.
not giving those opportunities or getting them. There's so
Hmm.
many different factors we can look at as to why not.
Yeah.
There's nursing care shortage. There's
Hmm.
so many different factors there. So that,
Absolutely. Absolutely. Yes, chef. So I'm just gonna throw
yeah,
it out there. Breastfeeding is hard.
absolutely.
I think that, you know, especially for new parents, I remember having my firstborn, and I'm like, okay, yeah, breastfeeding. I remember going to the prenatal classes, and seeing the diagrams. I'm like, okay, yeah,
Yeah.
I can do that. Okay. And then I have to bring this little baby home,
Mhm.
and then I'm looking at the baby, and the baby's looking at me, and I'm like, oh,
Yeah. What next?
what next?
Yeah.
And already, like, as you know, for a mom, like their body has already gone through like the
Yeah.
damn ringer. Put it that way, because labor isn't easy, right?
Mhm.
And there's all of these hormonal. I'm not going to pretend I'm a doctor or a nurse, but there's hormonal fluctuations and things like that, right?
Yeah.
And that just it impacts the whole person,
Mhm.
right?
So I think, again, if we go back to the common phrase of "I wish I'd known," it kind of
Mhm.
fits in so many different categories. For
Yes.
example, in regards to the hormonal changes. So one thing that
Yes.
we don't talk about is the significant hormonal change you have as soon as the placenta leaves the body.
Mm-hmm.
And then you see that change within 24 hours or so. And
Oh.
moms will most moms experience postpartum blues that can last for about 2 weeks. And
Mm-hmm.
the reason being is that you've got the fluctuation of estrogen and progesterone hormone that
Mm-hmm.
drops. It's higher when you're pregnant. It
Mm-hmm.
protects you and you protects the baby.
Mm-hmm.
And then as soon as you give birth and you give birth to the placenta, progesterone drops significantly.
Mm-hmm.
This impacts mood, This is such an important time to monitor. For
Oh.
those first beginning stages, in order for moms
Mm-hmm.
to feel success in what they want to attain, say that
Mm-hmm.
breastfeeding, as well as make sure that they're recovering in a really holistic way, what
Mm-hmm.
are we looking at here? The common denominator here is support, right? Like
Yeah.
support is key. But what does support look like? It's not just this fluff word that we throw around saying support. How are we establishing it? Have we discussed it prenatally? Has
Mm-hmm.
the midwife discussed what support really looks like prenatally so that they're
Mm-hmm.
set up in postpartum, right?
Mm-hmm.
So making sure we also understand, what does breastfeeding look like?
Yeah.
We talk about benefits, breastfeeding, but we don't talk about challenges.
Yeah.
So now we have this expectation that everything is going to go great because I have the parts, so it must work, right? But then, or I'm big chested, it
Yeah.
must work, but that's not the case. It doesn't matter about size. That's not what
Mm-hmm. Mm-hmm.
give people the knowledge and the rights to have that knowledge, to make informed decisions, and to also be content with whatever outcomes there are.
Yeah.
It's unfair. It's unfair. It's just so unfair for women in general in that sense.
100%.
Yeah.
Like I know that in times past, even just like, loved ones who tried to breastfeed and they just could not produce enough milk, right? Or, there's that beginning stage with, the liquid gold. What do you call it again?
Colostrum.
Colostrum. You see? That's why you're the nurse. All right. The colostrum, and the fact that that takes time to come in and the baby doesn't get a whole bunch of milk, but there's all of these like things that people don't tell you.
I mean, with colostrum, it's like it's thick for a reason. It's like
Yes.
thick milk for a reason. And it's not that you don't have milk, it's there, right?
Mhm.
It's a matter of moving that thick milk. One, that's
Mm.
one, right? So as soon as baby's born, the best thing to do is to, as long as everything is safe and it's clear and baby's able to spee on you,
Yeah.
skin to skin, ideal. That's the thing
Yes.
we should do. Baby on mom, and we keep baby there. We do not move baby, right?
Hmm.
If that's possible, right?
Hmm.
Another factor is making sure moving milk, and babies are not expected to have a lot in the beginning. There's this
Hmm.
expectation, feed, but their tummies are very small in the beginning. They're not
Yeah.
supposed to have so much. And then understanding there is weight loss in the beginning, and that is expected. Babies will gain back their weight within 2 weeks.
Hmm.
So having that knowledge, knowing that there's a certain percentage of allowed weight loss, and in the first day to day 3, day 5, that's where we work to try to establish that milk supply. How is that done? It's done with the proper support. And if you
Hmm.
don't catch it in that window, then yes, there will be challenges.
Yeah.
It's not impossible. It's
Yes.
possible. It's just finding the right supports for yourself.
Hmm.
Supports are not just lactation. It's
Yeah.
also like you're sitting down, you're breastfeeding, everyone brings you your food, your snacks.
Yes.
Someone can give you massages on your neck, like whatever it may be to help
Yes.
alleviate that stress, right?
Yes.
Um, it's really important to understand that, because
Hmm.
if we don't, we are now running into mental health concerns,
Yeah.
into intrusive thoughts, feelings of guilt, and you're alone in it, right?
Yeah.
When
Hmm.
you feel guilt, when we feel, or shame, I would say, when we feel shame, we kind of hide. We don't
Yeah.
ask for help.
Yeah.
So, yeah, yeah.
Yeah.
Mhm.
What are some of the mental health challenges, or like even just like the you were talking about intrusive thoughts, like what are the types of intrusive thoughts that moms may experience when breastfeeding isn't going the way that they would hope?
So, there's so many different types of mental health conditions that moms can experience. One of
Hmm.
the common ones is postpartum anxiety.
Yes.
With postpartum anxiety, as you know more than I would in this sense, but we hear a lot of postpartum anxiety equates to a lot of intrusive thoughts.
Yeah.
And so some of them would be, I'm not good enough for
Mm.
this baby. My
Yes.
baby deserves better.
Yeah.
And then some don't develop that. People say, oh, you're supposed to have this immediate bond with your baby, or if you
Mm.
breastfeed, you develop an immediate bond. Studies have shown, okay, yes, there
Mhm.
are some studies that show when you exclusively breastfeed
Mhm.
and there is no difficulty, yes, the hormone oxytocin is the anti-anxiety type of hormone, right? Okay.
Mhm.
If things are going the way that you feel they're going well, and there's no pain and discomfort.
Mhm.
However, if there is pain and there is discomfort and there's a lot of things going on in the background in families, things happen, right?
Yes.
Then it kind of counteracts, right? And so there becomes an imbalance in the hormones, and
Yeah.
we need to look at the whole picture. There's context here. And,
Mhm.
when we look at anxiety, so intrusive thoughts of not feeling like we're performing as parents,
Mhm.
new moms, sometimes they lead to thoughts of suicide,
Mm.
themselves or their baby. And this is why, as a community, as a family, as professionals in the community, in the hospital, we need to be well versed on how
Mhm.
to assess, how
Yeah.
to identify, so that we can get to it early.
Mhm. What about, the love bay mamas out there that, maybe they're feeling those feelings right now? Like, what would you suggest for them?
First, I would say you're not alone,
Mhm.
right? It feels lonely, and the process
Mm.
is lonely, right?
Yes.
Because you're in, especially at night,
Mm.
when you're going through a lot of that sleep deprivation,
Yeah.
I'm saying it right, yeah. You not
Mhm.
quantity that we need to look for, it's
Yeah.
quality of sleep. We're always it's perspective, right? Okay, we're not sleeping enough, but we won't we
Mhm.
won't be able to sleep long hours like you used to.
Yes.
Choose to breastfeed. So let's look at how do we get quality of sleep,
Yes.
right? People say sleep when baby sleeps, but no one talks about what does that mean? Because that's hard.
Yeah.
Like, right? No one,
Especially if you have like a cluster feeder or the baby's colicky, like what do you?
right, exactly. And so it's like,
Yeah.
you can't just throw around those lines and not give tools, support,
Mm.
different ways of achieving that. What does that look like exactly, based on what my family looks like, what my family dynamics, home dynamics look like? What does that look like for me? Because
Yes.
could look different for someone else.
Yes.
I have clients coming to us, we ask questions, their perspectives on breastfeeding, their family's perspectives on breastfeeding, what it looks like for them in the home, what support looks like, what do they understand about short-term and long-term goals of breastfeeding, what
Mm.
do they know about benefits for them, their baby, or family as a whole, and what would work, right? Some people have to go back to work early.
Yeah.
Now we have to work around that. What does that look like? Would
Yeah.
pumping work? If we pump, there are things to consider.
Mm.
So overall, my message, many messages, but
Yeah.
make sure you're active in advocating for yourself,
Mm.
not only in the healthcare space, but also in your day
Yeah.
to day
Mm-hmm.
home, in a way that brings people to work with you and
Yes.
supports you, right?
Yeah.
And if you need support in finding those words and tools on how to do that, ask a professional that can guide you in that direction.
Mm.
You're not alone is in it. There's so many avenues, and once you kind of open that door a little, and there's so many more that open up, because there's a lot of people actually doing this work to support women in this area.
Yeah.
It doesn't have to be one or the other. I always say breastfeeding is so interconnected with mental health.
Mm.
But a lot of the times we say, okay, if my mental health is suffering, I need to stop doing this. And then 4 months down the line, 6 months, I wish I didn't stop.
Mm-hmm.
What you hear,
Mm-hmm.
or I wish I did this, so giving all the information slowly, holistically, having these discussions, and then finding the best fit. It helps with finding content and peace in making those decisions. And then maybe we would actually have better outcomes in breastfeeding.
Mm-hmm. Mm-hmm. Absolutely. What are the biggest challenges that you've seen in your line of work?
I think I think the biggest challenge, because as a lactation consultant, we get a lot of clients who always come with breastfeeding difficulties based on certain anatomy,
Mm-hmm. Okay.
right? Say we have, you know, improper latching because of the anatomy of the breast.
Mm-hmm.
So if you have, I'll give examples. So like if you
Okay.
have inversion of the nipples or
Yeah.
flat
Yeah.
nipples, so that's sometimes a struggle in
Yeah.
the beginning. And
Mm-hmm.
so a lot of the time we parents give up because they
Mm-hmm.
don't have the right resources. So I see a lot of that, and we find ways.
Yeah.
So in the beginning, we find ways. How can we establish this for you? Because you're here to want to do this.
Mm-hmm.
You need support to do it. How do we do it? What
Mm-hmm.
tools and services are there to help you get there? You know, sometimes we use nipple shields in the beginning
Mm-hmm.
to get it established. And then
Yeah.
once it's established, we can remove it slowly. And there's a
Yeah.
process, there's a way to do it.
Yes.
Having someone that is there holding your hand through it all
Mm-hmm.
while you recover is important.
Absolutely.
So those are the challenges that I see a lot of,
Mm-hmm.
as well as just sometimes as simple as fixing a latch. Just a rotation of the baby, holding your hand a certain way, getting a deeper latch, and then the pain kind of dissipates, right? So
Mm-hmm.
then I start asking, okay, there is that gap at the bedside and going
Mm-hmm.
home. Families go home within 24 hours, 48 hours, right?
Yeah.
And then they have to wait to go to a breastfeeding clinic. And sometimes the appointment isn't until much later,
Mm-hmm.
right? But then some people can afford private breastfeeding support, right? There's socioeconomic status, things like this, right? That impact
Mm-hmm.
getting the support. So many layers here.
Yeah.
So I think that getting to families prenatally
Mm-hmm.
at the clinics, right? The visits,
Yes. Yeah.
you know, at the midwife visits, teaching them then doing, or them they themselves getting education on it. There's virtual classes as well, but I think we need to go more because those virtual
Yeah.
classes are a little, you know, surface. So I think that we diving deep, doing hands-on education prenatally would
Mm-hmm.
help. I hope that would help. I feel like that helped many clients that I've seen.
Mm-hmm.
I'm trying to think of other challenges. You know, I'm big on understanding your body when it
Yeah.
comes to response. So,
Yeah.
nervous system responses,
Mm-hmm.
inflammatory responses. There's research coming up about what your body goes through in regards to inflammation. So,
Mm.
being mindful of, you know, the stress responses. How do we reduce that? So, doing research on, I believe in nutrition, like
Yeah.
at the right type of nutrition for your body, antioxidants, reducing inflammation, eating
Yeah.
whole healthy foods. A
Mm-hmm.
lot of moms ask, what should I be eating? Should I be reducing this? And I say balance is key, but being mindful of the
Yeah.
type of foods you eat is also
Mm-hmm.
very important.
Yes.
You don't have to cut everything off. You're allowed to have desserts here and there. But if you're
Mhm.
having it 3, 4 times a day, every day, I mean, then you got to question certain things, right?
Right. Absolutely.
But yeah, and so
Yeah.
balancing it out is key.
Absolutely.
Mhm.
How would you say, things like anxiety, lack of sleep, and stress, how does that impact someone's milk supply?
So, you know, prolactin is the hormone that produces milk. Oxytocin
Mm-hmm.
helps. You know, we know all these things, how they impact.
Mm-hmm.
If it's going well and there are no stressors on the body and there are no stressors to the mind, so context is key. Do we know, does the mom have any mental health concerns prior to that would kind of lead to higher rates of anxiety and depression?
Mm-hmm.
Because when you have that and these stress levels increasing, it kind of counteracts the hormones that help produce milk. So ideally, you need that balance, right? You need the balance and you need the support in order to help reduce any inflammatory markers that kind of come up because of stress levels, right?
Mm-hmm. Mm-hmm.
And help your body do what it needs to do. Just
Yeah.
just like when you exercise and you're trying to build muscle, it's the same.
Yes.
You're mindful of what you take in, the actions that you do,
Mhm.
what you in order to achieve that goal, right?
Absolutely.
Sometimes it's hard, but it's just trying to understand what your body is saying,
Mm,
very mindful, being intuitive and listening
yeah.
is very important in that sense.
Hmm. You
Mhm.
know, we don't talk about this stuff, even about this, like the milk hormone. I didn't even know there was a milk hormone. I mean, it makes sense that there's a milk hormone, but but we don't really think about that. And just even, I often mention on our episodes that we don't realize how much our bodies are actually impacted by our mental health, right?
Yeah,
And I know that there's a bunch of pressure, that moms can carry, especially if we talk about, like, even like our family expectations on what even motherhood looks like or should look like, right?
right.
Like, how should, like, family really, like, uh, how should family support those that are pregnant and have just given birth? Like, what is the best type of support that people can give?
Be a part of the classes. So, for
Mm-hmm.
example, I do like this is the best thing that I've done so far for some clients that I was lucky to see
Mm-hmm.
before birth.
Mm-hmm.
So, a lot of them will bring, their partner, their mom, sister, and so
Yeah.
they're there to listen into the information.
Mm-hmm.
But it helps also guide moms to talk about their needs,
Mm-hmm.
wants, their birth plan, and then you have a professional explaining what that looks like, the evidence behind it, how it's helpful, and kind of gets everybody on board and understanding what she wants, what the partner wants, right? And so
Yeah.
I think that's the best thing that we can do because I think we do a lot of it alone as mothers,
Mm-hmm.
right?
Absolutely.
We learn a lot of it alone. We do the research alone. Um,
Mm-hmm.
and part of that could be us too, where we are just so quick to just take it on and do it. But being mindful of that and say, okay, let's sit together and learn this. Let's do
Yeah.
this process together.
Mm-hmm.
How I feel that I want it to go because what I'm learning and so on. Sometimes you have a lot of families. For example, here's a simple example, okay? So I always encourage paced bottle feeding. So when we're in the breastfeeding clinic, we do a lot of breastfeeding support, but
Mm-hmm.
then some parents choose to also pump and bottle feed as well half the time. So
Okay.
their partners can take over
Mm-hmm.
and mom breastfeeds during the hours that you make more milk is overnight because
Okay.
prolactin is a milk producing hormone that's higher at night.
Oh.
So if you miss those hours in the beginning stages, milk supply can go down. Those are
Oh.
really important hours to breastfeed or pump.
Mm-hmm.
So if there are times though where, mom wants a break when she has pumped or she just wants to pump, we support that as well. And we give them ways to give dad or their partner to breast or to bottle feed in a paced bottle feeding method.
Mm.
But when people don't know that, it kind of can alter the breastfeeding process.
Mm-hmm.
Going back at the breast may be challenging because if we're not pacing the bottle
Mm.
with feeding, and for example, if we're feeding like this,
Mm-hmm.
milk is just going down, right?
You're right.
It's like they're not really working to draw in the milk
Mm-hmm.
in breastfeeding.
Yeah.
Ideally, you want baby straight up and bottle, just like how you would breastfeed.
Oh.
So either straight up, but this is hard to do. You can't hold baby like this.
Yeah. I was wondering. I'm like.
Oh yeah, but like for lack of positioning. But baby could lay flat on their side on your lap,
Uh-huh.
and then you can just put the bottle like this. Let's see, like that. So this is baby, this is the bottle, right?
Uh-huh.
Like
Uh-huh.
that. So rather than
Oh.
like this, you just lay baby flat on their
Oh.
side, just like you would lay baby flat on their side on when you're breastfeeding.
Oh,
And then
wow.
you're gradually giving them the milk. You let baby open their mouth and ask for it. Then you put the nipple in. You let baby suck, suck, give them a little break. So we want to make sure we're imitating it. And
Mm-hmm.
so there are different techniques and different methods that we can support families. So we
Mm-hmm.
can support their partners, their family members to help them with the
Mm-hmm.
whole process, right?
Absolutely. What do you think is important for partners to know when it comes to supporting, a breastfeeding mom?
That it's not easy. One. Um,
That's for sure.
Also, I just like understanding the mental health complications that can come. Like understanding that knowing the challenges does not make it doom and gloom,
Mm,
right? And so when I feel like we're always so afraid to talk about certain things. We don't want to cause too much pressure. We don't want to cause too much stress, or we're tiptoeing around things. But I think there's a way to teach families to speak in a way that's empathetic,
mm-hmm,
understanding, but also giving space for those moments.
mm-hmm,
Only way that we could do that is if we understand what that process looks like, right?
mm-hmm,
Education on what those mental health concerns are and how
mm-hmm,
what they look like. That it may happen, it may
mm-hmm,
not,
mm-hmm.
right? But it's good to know, and it's good
Yeah.
to prepare yourself and how to support that family,
Mm-hmm,
or your partner or your family member, and then knowing, okay, I may not be good at this. What are the resources, right? And on top of that, the best thing about that, honestly, the best,
mm-hmm.
you give permission for that mom to feel how she feels,
That part.
right? Like,
That part. Yeah.
yeah. So there's no shame. There's no, yes, I'm feeling this way. I see you. Let's get,
Yeah.
let's get some help. Let's figure out what we could do because I may not be good at this, but I see it.
Yeah.
Let's go get that support. Let's find the right person for us that will support us as a whole.
Yeah. Yeah.
Yeah.
What about, listeners that, really want support, but maybe there's not like lactation consultants and stuff in their area, or
Mhm.
there's a long wait list. You know how the medical industry is. I'm sure it's a global thing, but in
Yeah.
our area, on our side of the globe,
Yeah.
there's a lot of lack of resources. And what would you say to those that need extra support, but it's is having a difficult time to actually find it?
So I think that we underestimate the type of virtual support that's available.
Hmm.
It's not, I still think that it's not the same as face to face,
Yeah.
but if you are able to get some tips, tricks, and some virtual support until that face to face support is available, might
Hmm.
be helpful.
Yeah.
But there are resources out there, although you are not able to say go in person. There
Hmm.
is a helpline, the nursing helpline that you can call, public health nursing line you can call for support. And there are supports from the Lech League
Hmm.
that will support you as well. And it's free, right?
Hmm.
It's available. And it's in a lot of areas. And I think that's another resource that people don't know about.
Yeah.
So there are resources out there. It's just a matter of finding them, but it's also not their fault because, in like they should be told, they
Yeah.
should be educated about this, right?
Yeah.
So that's another thing where I say, um,
Yeah.
have the questions ready. And that's one of the questions.
Mhm.
What should I know about breastfeeding?
Mm.
Okay. What kind of supports do I need and how can I get it? Do you offer it? Do you know anyone that offers it? Right? Like
Mhm.
there's no shame in asking all these things, right?
Yeah.
When you start ahead of time and ask, then hopefully that's the way that we can get those resources. Another thing is lactation support, although there is privatized health, like some people have health spending benefits
Mhm.
insurance, and that can cover it as well.
Oh, awesome.
Yeah. So if that's a
Mhm.
possibility based on their insurance, then great.
Mhm.
There's also lactation consultants that do sometimes sliding scale for
Yeah.
certain communities,
Mhm.
and it's just a matter of finding that support, right?
Absolutely.
Mhm.
And I know that this has also come up in other episodes, and it's also come up tonight quite a bit, but I think we underestimate the power of advocacy and asking questions. There is, like, I love that you said, there is no shame in asking for help.
Yeah.
And I think that sometimes we're afraid, and albeit sometimes, obviously there's systemic issues that contribute to why a lot of us don't want to ask for help. But I think it's also important to get the support that we need.
Yeah.
Because yes, I know that moms have been breastfeeding since the beginning of time, but it doesn't mean that it's not hard, right? And it doesn't mean that there aren't challenges that need to be overcome. And I just find that in general, like, our society has become a lot more individualistic, right? Whereas before, there was wraparound support, there was a community that will allow you to rest and stuff. And that's not every culture right now, or every person's experience. Some people are alone. There's a lot of single parents that are out there. There are a lot of people who don't have, if they've maybe migrated and they're maybe by themselves, with their children, and feel alone, right? So
Mhm.
it's so important to advocate for yourself so that you can get that support.
Absolutely. And we forget a lot too, you know. I think that I'm that type of person. I have to write everything down.
Yes, of course. Me too.
You know, I tell people, I'm like, you remember now. You may not remember when you go into that doctor's office or midwife's office, or, you know, you may not remember. And
Yeah.
in those moments, sometimes we kind of just go and want to be taken care of and told.
Yeah.
But that's not the case. These are people too,
Hmm.
many people in a day, and they
Yes.
may forget certain things. You
Hmm.
are your best advocate. And
Yeah.
once you ask them, you're actually helping them help you,
Yeah.
right?
Hmm.
And it's the best way to do it for yourself is writing it down. Anytime you have that thought, write it down. And now we have so many things where we could just talk to things and it writes it down for us, right? So
Hmm.
just take that moment to make sure that you find ways to advocate for yourself.
Absolutely.
Mm.
Absolutely. And there's no shame in that.
No, no, not at all.
Absolutely.
I say there's so much beauty in vulnerability
Yes.
because there's so much growth.
Yes, absolutely.
Yeah, for everybody, not just you as the patient, but also
Yeah.
wife, clinician, whomever you see. Yeah.
Absolutely.
Mhm.
Absolutely. And, you know, I know we all know it, that life doesn't always go the way that we expect. How
Mhm.
do you, you know, when moms aren't able to breastfeed, like they've tried everything
Yeah.
and it just doesn't work?
Mhm.
They had a plan, and the plan is just like, nope, nope, you got to bottle feed, or you got to, and, maybe they feel, guilt, or shame because of this. Like, what is your word of advice to moms who have tried and it just didn't work out?
I think that
Hmm.
I always start with asking them what and why. You know, like if they're feeling moments of guilt, where is that feeling of guilt coming from? Where are these ideas coming from? Why are we feeling guilt? If you are saying, right, we have tried everything,
Hmm.
you've gotten the support, you've done everything that you can, we've looked at the physiology of what's happening,
Hmm.
gotten all the support, but it hasn't worked out for you. Why are we feeling shame and guilt? Why are we
Hmm.
not feeling proud for doing what we can, in
Hmm.
all that effort? And
Hmm.
okay, it didn't work. It's the best thing that we need to see is that there is that connection that you are going to build with your baby.
Hmm.
Growth is not just with breastfeeding your baby. Bonding is not just with breastfeeding your baby. It's that connection to be able to, you know, provide mental development for your baby through conversations, through connections, through there's so much more to parenting than just breastfeeding. So,
Yes.
you know, yes, that's one piece that we can work on. We can find ways to work on it, do the
Hmm.
best that you can because it benefits baby and you, right?
Hmm.
But okay, if it didn't, what does that mean? Does that make you less of a mom? Not
Hmm.
not to that baby. That
Yeah.
baby thinks you're the best.
In the whole wide world.
Exactly, right? And the fact
Right.
that we're attempting and we're trying and we're doing the best that we can is all that we can do. There are certain things that are just not within our control sometimes. There are hormonal factors that are not within our control sometimes,
Yeah.
that we need to really look at. And in those times, I always say, okay, like if you want to kind of investigate further and see what's going on. And a lot of the times there are factors that we can see and we can identify,
Mm-hmm.
but finding the right clinician to help you is the
Yes,
ideal.
absolutely. And
Mhm.
I think that, like, where do you think like comparison plays into some of the pressures that moms might feel around breastfeeding?
You know, I hear a lot of the time is I saw this on TikTok, or I saw
The
I,
TikTok, right? For those listening on TikTok, don't, we're not. Okay.
I'm not, trust me, I'm on it too. I'm on it too. I'm on TikTok. I'm on
Yeah,
Instagram.
yeah.
All these social platforms. However, I do not agree with comparisons with people on TikTok or Instagram. I think
Mm,
that you need to speak to someone who has evidence-based information to give you,
yeah.
right?
Hmm.
And to talk to you about your situation, your case, because
Hmm.
every person is different, every body is different physically,
Yeah.
right? You cannot compare yourself to someone else that's doing, say, for example, a simple
Hmm.
example, one mom can produce so much milk in one pump session,
Hmm.
7 ounces. And so she has this oversupply in the fridge for her baby.
Hmm.
Another mom pumps the same amount of time, but only pumps enough for her baby that would need in that feeding session.
Hmm.
And then you have her thinking, "Oh, I don't have enough milk,"
Hmm.
because of that comparison that she saw.
Yeah.
But that's not
Yeah.
true. Your body makes the right amount of milk your baby needs.
Yeah.
Sometimes people do other steps to make more.
Hmm. Hmm.
Unless you know that, then you don't compare, right? But when you
Yeah.
don't have that knowledge and you don't understand how all that works, then you start thinking, "Oh, I don't have enough milk."
Yes.
But that's not true. There's evidence behind everything. There's conversations to be had before we start comparing.
Hmm.
So that's a simple example there. I hope that
Absolutely.
answers the question.
Absolutely, absolutely. And I think just with motherhood in general, at least I know back in the day when I was pushing strollers, and you go to those mommy and me groups, and it's like, oh well, my baby crawled at 3 months or 2 months, and but my baby is a G. My there's just so much.
Yeah.
There's just so much comparison that is out there.
You know what I think? I think it comes from a lot of insecurities, to
That's
be
it.
honest,
That's it.
right? So that's what we need to question. Why would that person say that? Like, we are supposed to be there to support each other, right? And support that process and
Mhm.
that time, that stage. But when
Yes.
someone says this, we need to look at that person and wonder, like, is everything okay? Are they okay?
Mhm.
Right?
Mhm.
Because maybe they're not, and that is their coping mechanism, right?
Yes.
So instead of internalizing that behavior, we need to
Mhm.
actually try to look at that picture and be like, babies are babies. Babies
Yeah.
thrive in different stages, different time. Everyone is different for a reason. If we were all the same, it would be a boring world. Like,
That is right. That's
you know,
right.
so I think that's what it is, really.
Absolutely.
Yeah.
Absolutely.
Yeah.
And, you know, just focusing on the fact that you are doing your best. I
Exactly.
think that sometimes that we forget that our best is enough,
Absolutely. Yeah.
right? And
Absolutely. Yeah.
especially, breastfeeding is such an intimate experience, right? Um, Especially in the beginning
Mhm.
when you're bonding with your baby, they're looking at you. Uh, it's just a beautiful bonding experience if that
Mhm.
is the path for you, right?
Mhm.
Um, but it's hard. It's
Mhm.
hard, and
Absolutely.
if you're doing your best, you're doing your best, and your body is doing its best,
Mhm.
right? And I think we forget how even though like a woman's body is just phenomenal, but it goes through so much during the birthing process, and I think that we need to make room for grace.
Absolutely. Yeah, for sure.
Hmm.
I think that we don't
Hmm.
acknowledge, many things of breastfeeding, the
Hmm.
beauties of it, but also the grief. that it, like, the space that it deserves for that,
Yeah.
right? And I
Yeah.
think that we need to give it that space.
Yeah.
Um, and that's why I say it's mental health with breastfeeding is so interconnected.
Yeah.
There's also things that we don't talk about trauma
Mm-hmm.
that women may have gone through,
Yeah.
body image concerns.
Yeah.
There's so many layers to look at here, and like
Yeah.
we can't say this is the reason why it didn't work or that is the there's we are a complex
Mm-hmm.
people, right? And so I think that there are many factors to look at. And so
Yes.
whenever I meet someone, I say, hey, if you can get someone to talk to during your prenatal period to have discussions, even group sessions. If you don't want to do private psychotherapy session, but I always encourage it because we've seen success when those conversations happen. Not
Mm-hmm.
success in breastfeeding in general only, but success
Yeah.
in finding peace in the process, success in
Mm-hmm.
reducing trying to reduce rates of, depression and anxiety, but being able to cope through it.
Mm.
It's not to say that it goes away. No, it's
Yeah.
there. But it's
Mm-hmm.
how do we cope? And
Yeah.
how do we not go to postpartum psychosis?
Yeah.
It's support, it's talking, having these conversations, and not
Mm-hmm.
shying away from getting mental health support, whether there's something going on or not, because hey, we all need it.
Yeah.
Like you
Absolutely.
said, we live in silos, right?
Yeah.
So
Absolutely. Absolutely. Why don't we talk a little bit about that grief and breastfeeding that you were talking about earlier? Can you break that down just a little bit more?
okay, so for example, when moms say, speak about, oh, I didn't get the chance to breastfeed, um, or I'm feeling bad that I didn't get to do that, and then people will say things like, well, at least your baby's healthy.
Mm-hmm.
Well, at least your baby's thriving, or this. We never find ways to give permission to say these things out loud, and then
Mm-hmm.
start to close off and not say anything because they're
Yeah.
afraid of, they have a
Mm-hmm.
thriving healthy baby, but then they're afraid of looking like they're complaining,
Mm-hmm.
right?
Mm-hmm.
But why
Yeah.
certain things didn't work out a certain way. And it
Mm-hmm.
could be anything, right? It may not be breastfeeding, it could be other forms of breastfeeding, parenting situations, or whatever it is. But I think we need to make sure we give that space to grieve that feeling of loss of what they wanted to accomplish and couldn't,
Mm-hmm.
and then giving them the opportunity to heal from it, right?
Yeah.
Because stress doesn't have, there's like small t's, big t's, like, right?
Mm-hmm.
From a mental health specialist, you would say, right?
Yes.
It's still a T,
Yeah, that's right. It's still a T, no
right?
matter which way you look at it. It's a T.
Exactly.
Yeah.
Yeah. The Canadian Perinatal Mental Health, they do great like group session programs, opportunities for people to come and have these discussions, working groups to have these discussions and be able to kind of work through their feelings, and finding those resources. One really other good resource is Women's College.
Yeah.
They have the reproductive life program. I may be
Mm.
saying it wrong, but it's if you get a referral from your doctor,
Mm-hmm.
you can be seen by someone in the program there, and they provide sessions, therapy sessions, group sessions, or individual. There may be a wait list, but it's good to get on it right away,
Yeah.
and you'll have that support. And you don't have to go in person if you're further out. You can
Mm-hmm.
virtually, right?
Oh, amazing.
Yeah, so it's really good. There are things out there. It's just a matter of finding them. Yeah.
Absolutely.
Mhm.
What would you say to moms that really just don't enjoy breastfeeding? Like the experience for them is just not it. They they can produce the milk and they just feel disconnected from it, or maybe
Yeah.
it's just not something that they want to do. Like what would you say to them?
So the way that I approach this is
Mm-hmm.
acknowledging the situation, right?
Mm-hmm.
Talking to them about what's going on,
Yeah.
asking them, trying to identify their whys, right?
Mm-hmm.
So that we
Mm-hmm.
could talk about it. And of course,
Mm.
giving them that space and respect is to
Yeah.
the choice based on informed decisions you make, that's up to them. And it doesn't make them a bad person or a bad mother that's not what this is. It's a matter of making those decisions as long as you have all the information that you need
Yeah.
to make that decision. But
Mm-hmm.
the reason, though, I say I try to identify what's going on is because a lot of the times, is it trauma induced? So if
Mm.
it's trauma induced, then we can't just say, okay, if you don't want to, that's okay. Here's a bottle.
Yes.
That I'm not doing my job as a health professional, right?
Mm.
Like I need to ask, okay, what it are we doing the Edinburgh scale? Identifying if there's anything going on postpartum in regards to depression or anxiety. Do we have anything else there? Is there trauma there? Just identifying what's going on. And yes, if they don't want to breastfeed, that's okay. But are there other things that we need to look at to help her through the postpartum period?
Mm.
As a lactation consultant, I will always
Mm.
talk about the benefits of breastfeeding for both baby and mom and
Mhm.
what the World Health Organization says.
Mm.
But I will also support families to make decisions that are best for them. We
Yes.
are not here to judge. Nobody's here to judge. We're here
Mm-hmm.
to give you evidence based information so that you can make
Mm.
informed decisions. A lot of the time, people make decisions from shame, guilt, and judgment, and that's
Mm-hmm.
not what we do, right?
Yeah, absolutely.
Yeah, I hope I answered that question that way because I know that's a common question people ask,
Mm-hmm.
and I do have clients that come to me to look for permission to stop.
Mm.
So, and in those situations, I can't give that permission. What I can give is information. I can teach you, guide you, and in whatever direction you choose, I could also teach you how to do that successfully.
Mm-hmm.
Right? So, say a mom wants to wean off breastfeeding. She's done it for about 5 months or so or less, and she wants to wean off.
Mm-hmm.
You need to also educate on how to do that without getting into clogged ducts, mastitis. Because if you have
Mm.
someone that's producing milk and now all of a
Yeah.
sudden you want to stop, you can't just stop just like that. There's a
Can't stop cold turkey.
no, no, not because you can cause a lot of pain, right?
Mm.
And a lot of concerns that can happen. So there are ways to wean, there are ways to do it. And so with support,
Mm.
with no judgment is what we need to do.
Well, tell us a little bit more about what it looks like to wean, because I know like there's different. Obviously, there's different stages of breastfeeding. Some moms breastfeed for a year, 18 months, 3 years, 5 years. From what I've heard.
Yeah, yeah.
So like, what does weaning even look like for a mom?
That's a big question because there are different, it depends on the stage, right? There's also, situations where they're unable to wean because baby's refusing a bottle because they're so
Mm.
used to breastfeeding,
Yes.
right?
Yep.
So there are those challenges that we
Mhm.
encounter. And so we look at how introducing bottles look like in a way
Mm.
where baby can accept, right?
Mhm.
Um, that's a challenging one. And then so sometimes we talk about if you're going to reduce breastfeeding, you can remove one session. So the idea here is if you're not going to do a full breastfeeding session, for example, you want to remove one session, instead of allowing yourself to get really full, you are going to pump for comfort only, but not a full pumping session. Because if you're doing a full session, what you're telling it's supply and demand. So you tell your
Yeah.
brain to make more milk when you're stimulating.
Mhm. Yes.
So the more you stimulate, the more milk you're going to make, right?
Yes.
It sends
Yes.
a signal. Now, if you're skipping a 6 p.m. session because you
Mhm.
want that time to not breastfeed, you want someone else to give a
Mhm.
bottle, say.
Mhm.
At that point, you are either going to hand express
Mhm.
to comfort or pump to comfort. So
Mm.
probably pumping just like 5-10 minutes or so until you feel a little less.
Mhm.
And then over time, what will happen is in that session, in that time of the day, for example, you may not
Mhm.
have that full supply at that time. So you slowly
Mm.
reduce the sessions. So there are
Yes.
different ways, but I mean, this is just a general. example, it
Mm-hmm.
depends on the person, right? It depends on the situation. It's very situational. So you really have to work with that person.
Absolutely, absolutely. So you've heard it, Love Bay family. If you're trying to wean your baby, it just don't go cold turkey.
Please don't do that.
Because you were talking about like mastitis. Like, explain that, because maybe there's a new mom listening and they're like, "What is that?" Tell us a little bit.
So okay, so if you have clogged ducts and you are not moving milk,
Mm-hmm.
sometimes you get to a situation where it builds up, and then you can develop, say, a little bit of infection. So you'll see that clogged duct in that area. You'll see some warmth to it. You'll see some redness around the area. If
Mm.
not attended to, then you start to develop flu-like symptoms.
Oh boy.
Okay, so the idea is not to get to that point. So when
Mm-hmm.
we have to make sure we're not getting too full, and we're like, you'll get full, so you got to move the milk, right?
Mm.
If you want to reduce the amount, then you obviously wouldn't pump or breastfeed uh, to the full extent of making more milk. I hope that's
Mm.
making sense. Yeah,
Oh yeah, that makes
yeah,
sense.
yeah. So that's usually what mastitis would look like. Those are the symptoms that you would see, and you would, if you
Mm.
get to that point, then you would need to make sure that you see a health professional.
Yes.
If at any point there's clogged ducts and you're feeling like pain in certain areas,
Mm-hmm.
applying ice is what you need to do.
Mm.
Apply cool compress to reduce the inflammation.
Mm.
Reducing inflammation and then moving the milk, you'll help reduce the clogged ducts. Never massaging the area. Don't
Mm.
massage the area. So in the past, we there was apply heat, massage area, but that could make it worse.
Oh, you know that I was thinking in the back of my mind. I said, "I thought you're supposed to put heat on it." What do you mean?
Okay.
Yeah.
So
Things change, man. Things change so fast.
new evidence shows that you need to
Mm.
apply a cold compress and then move your
Oh,
milk as well. It helps to reduce. If you think about it, inflammation, reducing it with cool, right?
yeah.
Yeah. Hmm.
Oh, wow.
Yeah. I
Yeah.
know so much, right? And I think this is why it's so important to have these conversations, and then you can make the decision you need to make, right? Like,
Absolutely.
mhm,
Absolutely.
mhm,
So what when it comes to self-care and breastfeeding,
mhm.
right? How do you how do you tell what do you tell moms who need to take care of themselves as they're healing, as they're nursing, and they're tired and exhausted? Like, what does self-care look like?
A lot of the time when we think self care, we think, I need to sleep, I need to go to the spa, I need a massage.
Mhm.
These are things that may not be attainable in that stage, right?
Mhm.
Self care does not have to look like that. To
Mhm.
me, self care is being able to identify the self,
Mm.
like being able to identify what is happening. Like, what am I feeling? What thoughts are ruminating here? Because we catastrophe, say the word for me, please.
Catastrophize or
Yeah,
something? Yeah.
exactly. And we
Mhm.
ruminate over thoughts and intrusive thoughts, and we sit there with it. But we really need, it's a hard thing to do, but being able to sit with yourself and understand what you're thinking. And the best thing that I would say in that moment is breathe, like doing the breathing techniques. People
Yes.
don't understand or not that they don't understand. I don't know if people have, or a lot of people have tried
Mhm.
it long enough to see its benefits, right?
Yes.
You can't say, okay, I've tried it once, it doesn't work. I'm still not, it's not working.
Mhm.
This is a practice that we need to put into place. And so that's one step of self-care that I always say
Mm.
is do the proper breathing technique. So even I say as simple as box breathing, right?
Yes.
So
Yes.
imagine the box. You take a deep breath in, you hold,
Mhm.
and then out, hold, in, hold, out, right? So box
Mhm.
breathing, it
Yes.
helps you do that and then
Mhm.
kind of reduce your nerves.
Yes.
And then making sure to find quality sleep. The value of sleep, right, is
Mm.
is so important. Not quantity, and I say emphasize this so much because people say I'm not getting enough sleep. No, yes, of course, right? But how do we provide that quality sleep so that you feel a bit refreshed and able
Mhm.
to move through these challenging times.
Mhm.
There will be other times where it won't be so challenging, and you'll
Yes.
have that opportunity to do even more things.
Mhm.
So I call them micro, like, wrong word. I forget. I used to call it something. So it's like small habits, small
Yes.
changes,
Yes.
small things in order to get ultimate, like, higher goals later. You can't
Absolutely.
run to the solution. It doesn't work like that. It's you got to start
Mhm.
slow.
Absolutely. Absolutely. So prioritizing those smaller bouts of sleep,
Sleep,
because
breathing. Yeah.
and the breathing, and the setting up those that quality of sleep, that
Hmm. And then one thing that I want to add
of
that really
course.
has really worked for me, even personally.
Yes.
So the body, you were saying,
Mhm.
really holds a lot of stress, anxiety, and it holds it in ways where you can tense up.
Yes.
As women, we carry stress in our shoulders
Mhm.
and our pelvic floor.
Mm.
So when you tighten that pelvic floor in your shoulders, like, I want you to listen to your body, everybody here, when you're doing the dishes, say,
Mhm.
standing in the dish and you're washing the dishes, I want you to stop for a minute and really pay attention to what you're doing to your shoulders. Are they up or are they down?
Mm.
And your pelvic floor, is it tight or is it relaxed? So this
Mm.
is something that possibly pelvic floor physiotherapists will talk about as well. Like,
Ah.
are you aware of what you're doing and how you're holding stress? Okay. If you're
Mm.
aware of what your body is doing, then you can impact, like, you can um, apply techniques to relax it. So
Yes.
when I noticed that initially for myself, I
Mhm.
would stop and I would do the breathing techniques that my pelvic floor physiotherapist told me to help
Mhm.
relax my pelvic floor and my shoulders. And I breathe, and then and then in that moment, I felt some relief because
Wow.
my body was so tense, right?
Mhm.
I felt relief. And gradually, I was able to then apply different things. So then I put a yoga mat in front of my bed,
Mhm.
and it just stayed there. So as baby got older and I was able to step away a little bit, the first thing I did when I got up was do 5 important stretches, and that set me up. It opened up my spine, so from here all the way down, and it helped to stretch out my spine and stretch out my hips, and you do your pelvic floor exercises, and it really opens you up to relax your body. And then I say all this because it's just you holistically. These things
Mm.
help you with
Yes.
mental health. These things do impact your mental health. Even in a moment of distress, maybe when you applied those things, you wouldn't react if you hadn't done it in the same
Mhm.
way. Do you know what I mean? But
Absolutely.
it's hard to see it because, I mean, we can't measure that, right?
100%.
So those are the takeaways that I would give.
Oh, yeah, I learned something new, because I knew about the shoulders, but I didn't know about the pelvic floor, and really just even noticing that,
Mhm.
and how we're tensing that, and that there are actually exercises out there to help you
Mhm.
to release that tension
Mhm.
also.
Absolutely. Yeah.
Wow, you see, I learned something new.
I
Wow.
am learning from you. So
Oh my goodness, this is lovely. This is so
yeah,
lovely.
no, I think we would do ourselves, we would do so many wonderful things if we continued to talk about these things and
Yeah.
throw gems. And you don't have to be a health professional to know these things. There's a lot of women out there that have studied things and applied certain practices and made sure that they
Yes.
were backed with evidence.
Mm-hmm.
There are so many ways to give back as well, right?
Yes.
So
Yeah.
and when you hear it, the one thing that I say to people is, whatever information you hear from me, go find the evidence,
That's right.
go find the research, because we're human, right? And
From a credible source.
right, of course, from a credible source. And the credible sources, like, there are many out there. Like, if you go to the hospital sites, like, for example, if you want to know, here's some things that you can look at. If you want to know, for example, a lot of parents look at information for health for their kids, like, say if they have colds or asthma induced colds or things like that. A good
Yes.
site would be About Kids Health. This is
Mm,
evidence-based. It's from a sick kids website. It's from a sick kids website, right?
mhm,
Alberta Health Sciences, CHIO. Like there's so many good resources that you can go to.
mhm.
You don't just trust Google, like just type anything on Google. If you do, you got to look into it further, making sure that it's credible.
Absolutely.
Mhm.
100%.
Yeah, absolutely.
All right, Niama, I'm going to ask you if you can leave the Love Bay listeners with one last gem or thought, what would it be?
Just as much as, yes, breastfeeding, feeding is important,
Mm,
so is your mental health,
yes.
right? And so is your physical health.
Mm,
They go hand in hand.
yes.
And it's important to find what works for you.
Mm-hmm.
It's also important to find people that will help you through it, right? The right resources. And if you need a second opinion or you get it, whether it's, um, you know, a nurse, a doctor, a lactation consultant, there is space for that. A
Yes.
lot of the times we give up. We say, "Oh, that's it," this is the
Mm,
information I got, and that's it. Or even in mental health, as a
mhm.
psychotherapist, right?
Yes.
Meet one person, it's not a good fit, so then they
Hmm.
give up on themselves and they don't ask for more support. But it's really, yes, finding that right fit.
Yes.
Find your fit. Find
Mhm.
that person that sees you, understands you and your family, so that you can get that support.
Absolutely. And where could people find you if they need you?
So I am I work for a hospital in a breastfeeding clinic. I work
Hmm.
at the breastfeeding clinic at Markham Stouffville Hospital. So they
Hmm.
have support there for moms. A lot of the
Hmm.
times people don't know that they can get support there.
Yes.
You could also find me through my business. It's called Postpartum Travel Nurses. And what that is, it's support for families in the not just postpartum, but it's like perinatal period.
Hmm.
And we provide support like breastfeeding,
Yes.
feeding, as well as nutrition support from
Hmm.
a gut hormonal health specialist,
Mm,
nutritionist. And then we have nurse psychotherapists and
mm,
psychotherapists on the team to
mm.
kind of give you that full package. So we
Yes.
kind of work together and see, okay, what's going on here? How can we check off things so that this is successful for you?
Hmm.
Because we can't just look at the body in one piece only,
Yes.
all of it together.
I love it. I
Aw,
love it. Well, thank you so much, Niama, for joining us tonight. Uh, our very first episode of 2026. Thank you so much for sharing your expertise, your wisdom, and your heart. And thank you also for reminding us that feeding our babies is never just a physical act, it's emotional, it's hormonal, it's relational, and it's deeply human. Whether you breastfeed, pump, combo feed, you use just formula, or choose a path that looks uniquely yours, you are still enough. Your well-being matters. You deserve support, you deserve softness and space to heal as you care for your little one. If tonight's conversation stirred something in you, or if you are silently struggling, hear this: you are not alone. Please reach out for trusted support. There's lactation consultants, there's therapists, there's postpartum nurses, there's community health programs, or even someone in your circle who can just hold space for you. And as always, the Mental Health Hour is here for educational purposes only, right? But we're here for you also, okay? So if you want, you can catch the replay of today's episode on YouTube. You could also follow us as we continue these very real, necessary conversations all year long, every week, every Tuesday. So thank you again for tuning in. Thank you again for choosing yourselves. And thank you for letting us be a part of your journey towards healing and wholeness. Next week is Baba Shop Tuesday. So we will see you next week. Until then, stay grounded, stay gentle with yourself, and take good care. Bye for now.